So we are going to go ahead and get started. This is the Women's Mental Health Panel. My name is Dr. Kate Cummins. I'm a licensed clinical psychologist. I have a private practice working with high performers, including athletes and coaches, and I am on the clinical advisory board for the Hidden Opponent. So it is an honor to be with these other incredible women today. And we're just going to go ahead by briefly having each of you introduce yourselves and tell us why you are here and what has brought you to the conversation today. Dr. Bartley, why don't you go first?
Well, I'm Dr. Jess Bartley. I am currently the Senior Director of Psychological Services at the U.S. Olympic and Paralympic Committee, which means I oversee mental health and mental performance for Team USA. Been in this role for about 5 years, building out our resources, and also work a little bit in the Denver area with some professional sports teams. So that's kind of what I'm bringing. Nice to meet y'all.
Jessica, do you want to go next?
Great. Thank you. I will. So, hello, everyone. I'm Jessica Scheer. I'm the acting CEO at the National Eating Disorders Association, also known as NEDA. I come to this conversation as my family has lived experience and sports did play a role in our story. NEDA is also the largest digital resource for people to understand what eating disorders are and what their treatment could be, as well as lots of support resources for caregivers and others in around our those who are affected. Our mission is to fundamentally change the way that eating disorders are understood and treated so that those affected can achieve lasting recovery and well-being.
Thank you. Alice, would you like to go next?
I'm Alice Merryweather. I competed for Team USA at the 2018 Olympic Games in alpine skiing. And then a few years later in 2020, I was diagnosed with anorexia. And my journey back to sport and through recovery brought me to Athletes for Hope as a Wellbeing athlete ambassador. And it led me to work with Dr. Bartley some. And so I'm really passionate about athlete mental health and women's mental health. So just happy to be here.
Thank you. Alexandra?
Hi, everyone. First, I apologize for any background noise. I started as a filmmaker and I'm here at Sundance Film Festival, so we have a little bit of that in the background. But I am the CEO and founder of Project Blackbird, which is a national nonprofit that is committed to helping not only to end the stigma around mental health, but also to provide direct resources. And we do so through a traveling program to all high schools, colleges, and we're actually entering the middle school and elementary school space where we use film and storytelling through professional athletes and actors sharing their story on a panel. We have them share their story around lived experience with students across the United States, and following that engagement and that awareness and that presentation, we provide as an organization a year of free therapy for every student in the audience in need. We are actively there signing up the students, and then we bring a resource fair into the back of the room so that they can connect with the local resources, other nonprofits that are invested in this space, really helping each student to feel seen and making sure that as an organization, we provide a grassroots program that helps every community member know that they're being seen as individuals, and there is no one answer to a resolution for mental health. It's about being seen and being understood. And so my personal passion for it came from my own struggles. I was diagnosed with anorexia as well back in 2018. I was out in Los Angeles. I met another young woman at a treatment center who was very different than I was, but struggled as well. And we realized how connected we really were when we were able to vocalize it and share it. So we felt seen in the moment, and we replicate that now as we go on tour.
Thank you for sharing, Alexandra. Just as the unique individuals in this space all come from varying backgrounds, but we're all, here to support mental health and provide resources in different ways, whether it's your individual story and journey or the clinical aspect of it. I just think that it shows that systemically there's more than just, therapy and the person that is in therapy when we look at the whole of mental health. And so I hope that this conversation can really facilitate destigmatization, awareness, and just like increased levels of all the different resources and avenues within the space of mental health. So with that being said, the first question that I have for each of you is, how does the pressure to perform, both in an athletic context, but also in a social and societal context, uniquely affect and impact women? And I will let you all just come off mic and, share as you wish.
I'm happy to jump in here. I mean, from my own experience, I felt like as an athlete, I had to look and feel a certain way to be my best physically, to perform, to be able to go 80 miles an hour on skis, and that required a certain body type. And that body type was very different than what Instagram was telling me, what society was telling me, the ideal woman looks like. And it got really confusing. I think athletes, the optimal body for an athlete oftentimes does not agree with, the optimal body per what social media is feeding us and what norms are maybe telling us. And so I think the more conversations like this that we can have that explain that that's just not, there's no optimal body, there's no, like, these are just made up ideas. I think that it's super helpful to be sharing this and to be talking about these things.
Sorry, figuring out how to unmute myself here. I think it's an experience that that happens. I think it's everybody, not necessarily just women, but I will say, I think for a lot of women, we grow up hearing the messages, you're too much or you're not enough. And I think I think as you grow up, those messages continue to seed in your mind. And when you enter the workplace, especially, you kind of have to be overachieving. It's, well, what have you done to earn this position? And I will say, this is outside of the athlete space, but in the corporate world, when I first started my corporate job, I I was always, first of all, trying to figure out what my style was, and I was looking at these male leaders who were very blunt and forthcoming, and I felt like I had to perform in that way. So it was not learning to listen to myself and how I operated, but learning from others that just weren't like me and trying to replicate that. Um, but there was always this pressure to prove myself in the workplace, like I belonged there, because I didn't walk in personally. The narrative in my mind was not, you belong here. So I had to prove it to myself. I had to prove it to everybody else around me. And I think that's something that a lot of friends and colleagues of mine have shared in the female space, that first entry in the workspace, that was the environment. I also know from a hiring perspective, when I was hiring in both the first corporation that I was with and then also in my own, I find that if I offer a role to a man and a woman and it's the exact same role, I find that men will, more often than not, will accept that role whether they're qualified or not. And a female, if she doesn't think she's qualified, might say, I don't know if I can do it. I don't know if I'm fit for that role. And I wonder personally if that's just, again, the narrative that we were fed maybe it's the past generation, but narratives that were fed as we're younger, and feeling that need, again, that need to perform, that need to prove, and that need to be enough, I guess, feeling as though we're not enough already. And again, I don't want to make that blanket statement, because I don't think that's every woman, and I don't think that is not experienced by any men out there as well. But I have found that that's something a lot of my friends and colleagues have voiced, that are women that are experiencing this as well.
I think what both of you are discussing is the social conditioning and the performance-based value and worth that we as a society, specifically with women, really put a lot of pressure on. And what you're speaking to is something that is very much a part of the system and culture, specifically with, female athletes, but with women, period, around the world. And Dr. Bartley, you could probably speak on the clinical pieces of that as well.
Yeah, I guess I was going to add, I think it's the way I look at it is we're all performers, regardless of the job. And I think what Alice and Alexandra kind of like ties that together is, I work primarily in the athlete space. But I think we all perform and we're all trying to get up there and do our best. And I do think some of this messaging that comes from so many places, and it's coming from our families and it's coming from our friends and it's coming from society. It just comes at us from all angles. And so I think that that is what's so difficult when you have all of these, I think Alice had made up constructs in our head about how we're supposed to be, how we're supposed to behave, in the world. And I think that that's what's often coming up as I'm meeting with athletes and performers, is I'm supposed to be this, I'm supposed to be this. And again, who says that? Like, why? How? And so I think that that's so very hard. And I do think it really impacts both genders, but I think there's very specific things that women are often told to be, to do, to act. And again, it's a little bit more submissive and quieter. And again, like Alexandra said, not, or am I enough? Should I be here? Because I think she pointed out some excellent points that come up all the time, is should I even be here and in this space and competing or performing or whatever it may be. And so I think it's really important just to know that there are so many messages being sent to us all of the time. And we're often having to undo that, to rewire our brains, to think about it a bit differently, that we are enough, we do belong, we are here, we can have space. And I think that that's just really hard because we are conditioned so very much otherwise.
Thank you, Dr. Bartley. Jessica, do you have anything to add?
Well, I guess the thing that comes up for me is, when we talk about, eating disorders and specifically about being complex, mental health illnesses that have a variety of factors that drive someone to develop one, and the fact that women are exposed to both the personal narrative and the societal narrative at the same time. We know that folks who have a perfectionist type of bent, who have a certain drive to succeed, those behaviors that actually help them do that work when it's too much or becomes overbalanced, right? And there's other things that are pressing on them, whether it's a genetic background or other folks in their family have experienced eating disorders or anxiety or depression. All these things just put you at greater risk for developing an eating disorder. Like there is a reason why there's more women right now identifying and stepping forward for treatment for mental health and eating disorders. Largely, like we think of that as more of a women's issue, unfortunately, even though eating disorders don't discriminate. And I think that's a product of it, is just like recognizing the complexity of the lives that we live, the roles that we have to play, and the unique pressures that women become, particularly, exposed to as a result of just all the different roles we have to play in life.
Absolutely. And, what you're speaking to is sort of like when the threshold moves from the normative pressures and the things that we all are interfacing into this clinical component. And so that beautifully bridges over to my next question. So for any of you who want to jump in, what are some key factors that may or may not influence whether a female athlete feels able to seek mental health or help for their mental health?
I can jump on that because, again, we've designed this entire program at the U.S. Olympic and Paralympic Committee. And I think that there's a lot of factors, and we've done a lot of homework around how do we, understand those factors and break them down. And I mean, there's still a lot of stigma. And I think we find that there's a lot of stigma in the athlete population, because there's a certain persona or way that you often think about athletes, that, that would be weak, or, they lack resilience. And there's these pieces where, in my experience, I think the ones that have come forward, it's incredibly strong to say, I need this, and this is what I need to get better. That's what I feel like the best of the best are starting to do is, I need help. And this is whether it's nutrition or strength and conditioning or the psychological space. How do we break down those barriers when there is stigma? There are other factors too, where when we work with a lot of athletes, it's time. Like, who has the time to prioritize themselves? Sometimes it's the resources. So I may have the time, but I don't have the money to do that, which is where I loved hearing about, that there are other organizations helping with that. Like, how do you break down all of those different pieces? But again, regardless of time and money, I still personally think that athletes have a lot of stigma around seeking help. And again, there's a lot of us trying to break that down. So again, these panels are so very important. But those are some of the things I see for sure that influence their ability to get help.
And I'll just add in really quickly, Dr. Bartley, and then switch it over to you, Jessica. But just as a private practice practitioner who works with athletes and coaches, pro athletes and coaches as well, I think it's really important that as we continue to destigmatize the conversation around mental health, it's also important that athletes advocate for the right clinician, because sometimes, like, the team clinician that they have access to is not a good fit. And that doesn't mean that that person is not a good clinician. It just means that for this individual, they need to find the right treatment. And so oftentimes I think in mental health, like, we just have to continue patient advocacy. Like, if you haven't found the right resources, there's so many out there. And I think that you just have to keep searching. And that comes with these type of conversations as well. Go ahead, Jessica.
I think a big part of what comes up for us as an organization when we're talking to families is understanding the opportunity cost of seeking help for a mental health illness, and or for our case, an eating disorder, what that means. Oftentimes people, when they first start struggling, they are still doing really well in their sport or in their school life or in other parts, in their academic lives or their social lives. And it's about how, when these behaviors, whether it starts out as disordered eating and then eventually becomes, a clinical issue, where's the line? When do you say, oh my God, I need to pull back from my sport, or I need to change the way I'm leading my life in order to, how do you get someone off that on ramp onto, a really serious mental health problem, right? And like learning finding, getting a good team behind you to understand what your milestones might look like along that path, because no parent and no athlete wants to, frankly, get off the road to success, right? Like, nobody wants to do that. But we know what happens, that as these behaviors get more and more embedded, frankly, the sicker it is, it's that person becomes more ill, and then it might be harder to realize recovery at the other end of it. So that's really challenging.
I can jump in quickly to I wanted to touch just on, I think, the three that you mentioned, the three pillars that you mentioned, I see a lot as well as we take this on tour. Athletic departments are actually probably one of our largest audiences. We are doing a lot of athletic departments right now. And so as we started bringing this program to athletic departments, we really wanted to better understand the athletes. So we did a lot of focus groups with student athletes to understand their needs. And you mentioned stigma. I think it was stigma, time, and resources. And all of those, the stigma. So that is something that we address in the program. We know we address in the program. We bring their heroes and role models, sharing lived experience. But it's more than, I think it's more than bringing another professional athlete on board. It's more than bringing someone they look up to. I think it's also the coaches and how they lead by example, top down. And so that was one pointer, or one point that was voiced by a lot of our student athletes. But another was time in a different way. It was timeliness of care. What they asked for was, are you able to provide therapy that we can get today, tomorrow, not 6 months from now? Because a lot of programs are at least for the college campuses and schools, they are trying so hard to provide the support. But Dr. Kate, like you mentioned, it might not be the right practitioner for that student, or they might just be over capacity. I mean, they don't have enough support on campus to help every single athlete right in this moment. So those that really need help immediately can't get help for months. And so timeliness of care, and then resources as well, as you mentioned, sometimes it's just not knowing the right resources out there, or when you finally realize that you struggle, it's so overwhelming, where do I turn to? And one thing that I found very helpful when we do our athletic events, we have all resources, but we really bring athlete specific resources. And I will say, and this is from my personal background, one resource that I found to be incredibly helpful for a lot of our students, it was an eating disorder treatment center for athletes. Recognizing, and Alice, I think you alluded to this earlier too, that athletes have a different a different body standard, conditioning standard. Your job does involve conditioning and training, and that's really difficult when you're healing from an eating disorder. And a lot of the treatment centers just aren't equipped to care necessarily for those needs. So there are some very athlete specific resources out there, treatment centers out there, where they can both help heal and help you continue your job, dream, passion in a way that is healthy for your mind and your body. So I think, again, touching on just those pillars: stigma, timeliness, and resources.
I can just piggyback on that. I'm a proud product of one of those athlete-specific centers, the Athlete Edge at ED Care in Denver, and I'm so grateful for that kind of individualized care and the way that, for me, they were able to add, physical activity into it in a very measured, very thoughtful way, taking into account, not just the general eating disorder side of things, but how that played into my athletics and how these were all combined in my brain and how to kind of sort out all those wires. But I would also say that for me, the hardest hurdle to actually take the step and get treatment was convincing myself that I needed care and that I deserved care and that I was sick enough to get care. Because once I realized something was really wrong, I felt like I got myself into this mess. I can get myself out, right? It was my fault, and I needed to be the one to figure it out. And so I was really unwilling to accept other people's help. And I was really lucky. I was super well supported. I had a really amazing team around me, both my actual teammates, my family, medical staff around me, and they made that process easier once I started to understand that I really did need a high level of care. But I was definitely kind of the last domino to fall, where I didn't feel like I deserved getting a higher level of treatment because it felt like it was my fault and I needed to be responsible for getting better.
Thank you so much for sharing that. To piggyback on that exact topic, Alice, how do we all think that teams or organizations can make the process of accessing the right mental health care and treatment less intimidating and more accessible?
I mean, to jump back in, I think a baseline level of education is key. I had a kind of a mixed bag of people around me, some who had a decent education in mental health and eating disorders, and many who did not, myself included. Like, I had learned about eating disorders in sixth grade health class, and that was the extent of what I knew. So when it was actually happening to me and affecting me, I didn't understand what was going on. Also, ski racing has a lot of European male coaches, and none of them have any sort of background on eating disorders or mental health. And so I think what still made my recovery really possible and even allowed me to go to treatment when I did was that even the people around me who had no education put in the effort to try and to understand and to be thoughtful about how they interacted with me and how they showed up to support me. Like they recognized that they didn't understand what I was going through and they couldn't understand what I was going through, but they acknowledged that they cared and that they knew I wasn't okay and that they wanted me to get that kind of support. And so I think some of that can be, a little bit smoother if everyone actually, especially in the sports space, like whether every coach at a certain level of sport has to get a baseline education in mental health training, how to show up for athletes when they need it. Also for athletes to understand warning signs. Why don't, all youth sports, every young athlete, gets a baseline education of here are some warning signs, here are things to look for, both in yourself and in your teammates. But I think having that kind of open mind, if someone around you is struggling, if your teammate is struggling, the fact that everyone around me was able to be patient and try to be understanding and they just leaned into the learning process, I think that made a huge difference and made it a much easier process for me.
And then I'll just answer by saying that really, really at its core, that is exactly what it's exactly what we aim to do at Project Blackbird. That's why this was created, was to help everyone, and now especially the athletes, to help them feel seen and less overwhelmed. And so it's by providing a panel with their heroes and role models, being vulnerable about it, so that the athletes can realize that it's okay to be human and it's okay to ask for help. It's not okay necessarily to just struggle, but it's okay to struggle and say, you know what, I actually need help and I need to reach out to someone else for it. We do a journal prompt as well, where all of the students fill out what they struggle with and a message of hope, and it's all anonymous. We have them leave it behind and take home a prior participants. And Alice, as you were mentioning, your peers, I think that's something that is really important as well to make it less overwhelming, is knowing that you're not alone, that others out there are having the exact same thoughts. We just don't talk about it. And then the culmination of having the resource fair there, that came about because it is incredibly overwhelming once you acknowledge that you're going through something. Resources are there, but there are so many, you don't know where they are, you don't know what to do. It's so overwhelming that a lot of times I think a lot of individuals just fall off and choose nothing. And so the idea behind that is, while you are feeling in the moment like it might be safe to open up, before you have the chance to walk away and lose that energy around it, lose that safety, providing those resources right there on the spot, and then building the trust of having whoever is running that treatment center standing there, being human, being able to interact with the student or community member that needs it. I think that's how at least we're trying to make it much less overwhelming for anybody that's really in crisis or just are struggling in any manner.
Yeah, I was going to share from my perspective as a provider that I love what Alexandra said about just being human. I think that particularly at the USOPC, we often share that like no door is the wrong door. We're always on the road with athletes. We're just a part of like the fabric. We're another one of the providers that are around. We're kind of in all the places and trying to be around when they're at camp, when they're, onboarding to the team, when they're at competitions. We'll be at the Olympics, in just another couple of days. And so it's cool to think about like all the places we are, and we're just kind of normal people, and asking about how your family is or how that class is going in college. And we kind of know a lot about everyone's lives. And I think that feels really similar to what Alexandra is saying about the strategy is just, how can you get it on demand? I love the idea of the right provider. I think that's where we've also designed this at the USOPC, where we have providers that may look like you, maybe your race and ethnicity, might be your religion, might be, and so you have a number of options, and we have full-time providers, and then we have a directory of providers. And we follow up immediately. I think those are the important things, is how do you have someone that's going to fit your needs and quickly. Lists have gotten really long for care, and I think you just need to know what those resources are. And so I also love the idea of like education. We've been doing mental health literacy with coaches, with sports medicine. We've been doing it with performance. We've been doing it with our communication staff. And then we also do it for the athletes themselves. And how would you recognize this? We actually do, when we do mental health literacy, it's just the athletes. And so they have a space that's just them to kind of talk through. But I think all of those pieces are, everyone's getting a little bit more savvy on how to make that happen, especially for a group like athletes who need it right then and there. You may lose them. They may not follow back up because they just don't have the time. Again, like, you need to capitalize on that. And so those are some of the key pieces that I think do work with athletes, but just generally, I think that that's what's really helpful, is to have different options, have it be really timely. How do you even understand? How do you point someone in that direction? And again, I loved what you said about just being human. Like, we're all just, we all have mental health. And so how are we all kind of taking care of each other?
Just to piggyback on the education piece, Alice, as you were speaking, being on the clinical advisory board for the hidden opponent, we provide education and resources to our campus captains, which are individuals that apply to be a part of the program. But gosh, if every single collegiate athlete interfaced with the providers, because each one of us is a psychologist or a mental health care provider, and we're doing like athlete-based training specifically for college age students. So, can you imagine if every single individual that was in the sports world had to go through this type of programming, just how human first, normalized, destigmatized, as Dr. Bartley said, we all have mental health, right? And just like gaining access and ownership to resources then helps us figure out how to find the right places that are, going to best serve us so that we can help reduce symptoms and have a better outcome for, everybody's quality of life. So, yeah. Jessica, did you have anything to add on this at all?
Oh gosh, you guys are so brilliant and cover so much ground so quickly. I think just because you were talking about individual resources, Nita created a coaches toolkit that we actually did in collaboration with ED Care. So it is clinically, backed and reviewed, and really gives people, coaches, the explicit support about like how to recognize those warning signs, how to have thoughtful, sensitive, compassionate conversations. It goes through the whole thing about how to best show up. And frankly, there can be, as you all have outlined, a lot of work around help seeking. This isn't a one and done. It often takes someone multiple attempts to get, not just the right diagnosis, but the right team. We know, sadly, that folks often go years without, before they're able to get that care in place, anywhere between 2 and 6 years. And it can be a long journey for many people. So making sure that the folks around them, especially coaches, know how to be a more proactive member in that experience is really important to us. So.
Yeah, it takes the whole system to support the individual, right? So providing education and resources to coaches and everyone is, a part of the process of that destigmatization. The last question that I have for you all is, if you could change one thing about the culture or system of women's sports to improve mental health, what would it be?
I'm going to come back to my education piece. I think that at least when I was still competing, that's something that just felt like it was missing for me and for so many of my peers, where people didn't have a great understanding of mental health and what that meant for each individual and what mental health care looked like. And I've even seen so many improvements since I went to treatment in 2020 and on from there. I've seen this conversation grow and there's so much more awareness, but I also think there's still a long way to go and just setting that baseline education so that athletes all have an understanding of what to look for and what full health looks like physically and mentally.
And I'm going to agree with that. Oh, sorry. Just wholeheartedly education, athletes, but also top down, the coaches. I think education from that level so that they can also provide the safety of awareness for the athletes that are training underneath them, with them.
The thing that comes to mind for me is the culture that forms around our athletes, that athletic environment and in leadership, and that's both formal and informal, right? The coaches, the assistant coaches, but the senior athletes, the really strong players on the team, what they say and don't say when it comes to performance, when it comes to breaks or taking a rest, recognizing the whole athlete, body talk, all of these things, that's what forms culture and ultimately will make it more conducive to help seeking, right? When people can share more of themselves and raise their hand when something happens. But that's displayed through all of those small everyday conversations and interactions that we have.
Yeah, and I think I can probably, again, all of what's being said is so incredibly brilliant that it's like all of those things. Like, what would it be like if we thought of, the fact that everyone has mental health, or mental health is health? It is this whole kind of body, whole system way of thinking about things. And, what if everybody was talking that way? And as Alexandra said, the coaches are so important, the teammates, but our family, our friends. And I get the question a lot working with Olympic and Paralympic athletes about some of the movement there. But I think any voice really matters. I think anyone talking about their mental health or, I need to take a break or a rest, as Jessica said, like the more that we're really kind of, furthering that message, it's moms to their kids, it's like grandmothers to their grandchildren, but it's people on social media, it's the whole system, that if we can all start to, I guess, quote unquote, talk like that, it's really like shifting all the culture. I do think that athletes have a huge role in all of that, but again, I think it, as Jessica also said, it's all of it that's really important. So again, I think that we could take everything that was just said, educate, and we could all be a little bit more kind to each other when we're talking about those things. So that's kind of threading the needle through everything.
Thank you. And just really quickly, what in this dialogue conversation, as we have processed all of this, what gives you hope for the future, specifically with women and mental health and women athletes?
For me, it's the people that are on this call, like hearing these voices and hearing about the work that all of these women are doing. This is what it's all about, and this is how change gets made, and these women are the people who are doing it. It's really special.
I think it's also amazing in this conversation how all of us, I mean, we've all said, I'm going to piggyback off of this, actually exactly what they said, this is correct, and all of these things. We're all so in alignment with what needs to be done, which tells me that the awareness is there. There are so many that understand this. There's no doubt in my mind that we will get there. And even outside of this conversation as well, I think you see a lot of change generationally. And I do, at least from the work that I'm doing, when I'm interacting with the youth, I see the want there to speak. I see the want to make a change. And somebody just said it. I think it might have been Dr. Bartley. I think it might have been you with the mothers and the daughters, or the fathers and the daughters. But these these kids are going to be teenagers. These teenagers are going to be adults. These adults, many of them are going to be parents. And when they start speaking differently to their children will start understanding these messages differently. So no doubt in my mind, there will be a change amongst the way that we think about mental health and the way that we think about our own minds as women and as individuals just in society.
Oh, yeah. It sounds silly to say piggyback, but I will on that too. Like I have a 2-year-old and an 8-year-old daughter, and I think that spaces like this give me so much hope. Sometimes it's hard to be away from my family with my job, and I just love, the role models that my daughters will have the opportunity to look up to, or even my son. I have a 5-year-old son who's looking up to really strong, incredible women who have incredible messages to share. And I do see the generational shifts. I'm seeing shifts within the last 5 years, the last 10 years. So it feels very hopeful for the future. And I think myself being a mom, I think that's why I do everything that I do, is I very much hope that they have a different experience playing sport or doing, being social living than I did growing up sometimes. But I can already see it. I can already see some of the change. So I feel really hopeful about that.
Gosh, I mean, I'm just so inspired by everything here. Alexandra, you said it perfectly. I think the fact that we're finding big ways and small ways in our professional settings and how we show up in these athletic cultures and in our personal relationships, that we're creating space for that small voice to be heard and to be voiced and to be listened to. And, that at NIDA, we are focusing more than ever on early intervention because of the power and hope it holds, more so than any direct line of treatment or a really promising research study or any of that. But if we can help people find that small voice, that is the key to unlocking a much more sustainable and durable path to recovery. And it just makes me hopeful that there's more space for that in all the places that we show up as women and as athletes. So there's a lot to be hopeful for.
I hope that each and every one of us gets to really be a part of this cultural shift to where, talking about your mental health is just like talking about the weather or what you ate for lunch, and it's so normalized that, it's a part of the package of the holistic approach of being human. And I think that, conversations like this certainly help us move the needle towards that destigmatization and normalization so that everyone can get the right resources that they need. It was such a privilege and honor to be able to spend time with each and every one of you, very incredibly strong voices in the women athlete space. And I just so appreciate this conversation and meeting each and every one of you. And I look forward to seeing what we can all collectively do in the future.